Good afternoon, ladies and gentlemen. My name is Deidre McClendon, and today we will be discussing the activation of the Rapid Response Team. Today, we will discuss the objectives of the Rapid Response Team. Those objectives include reducing the number of cardiac arrests on an acute care setting, reducing the length of stay in hospitals, and providing a continuous surveillance system to monitor patients for signs and symptoms of physiological deterioration. Let's talk about cardiac arrest in the acute care setting. According to the Institute of Medicine, each year approximately 2,000 cardiac arrests occur in the hospitals. Of those 200,000 cardiac arrests that occur in the hospital, 24% of those patients survive. According to the American Heart Association, cardiac arrest is the #1 leading cause of death. Every year, nearly 230,000 to 325,000 people have cardiac arrest outside of the hospital. Only 7.6% will survive. Heart disease kills more people each year than cancer. To improve on the matter, some hospitals have pioneered the use of early warning scoring system, in addition to using the rapid response team to more reliably identify patients and implementing life-saving treatments. The implication of the rapid response team caused a significant reduction in cardiac arrest, including a 50% reduction in non-ICU arrests, a reduced post-operative emergency intensive care unit transfer rate down to 58%, and deaths to 37%. Let's take a look at the overview of the capstone project. For the Peacock questions is as follows. In the acute care setting or the hospital, how does the rapid response team decrease the cardiac arrest rates outside the critical care areas compared to not having the rapid response team present while the patient is recovering during the first few weeks? Let's take a look at the rapid response team. The rapid response team consists of an ICU nurse, a respiratory therapist, a pharmacist, and a physician assistant. Let's talk about nurses knowing when to activate the rapid response system. Please note that any nurse may activate the rapid response team when a rapid assessment is deemed necessary for a deteriorating patient. Based on any of the following: staff member is worried about the patient, significant bleeding, acute change in heart rate less than 50 or greater than 30 beats per minute, seizures, acute change in systolic blood pressure of less than 90, acute agitation or delirium, acute change in respiratory rate less than 10 or greater than 28 breaths per minute, acute changes in oxygen saturation less than 90% despite oxygen being delivered, acute changes in level of consciousness, acute change in urinary output less than 50 mLs in 4 hours. Let's talk about some of the ways to activate the rapid response team. You can activate the rapid response team by cell phone or by pager, and in some cases they have a bedside alarm activation system depending on the hospital. Now let's talk about the literature review and how we came up with our search based on this following database. For electronic database, we use the CINAHL search system. We search health and nursing. We set our limits to 5 within the last 5 years. We want research articles and we want them peer reviewed. Keywords we used in advanced search were the rapid response team, acute care unit or a hospital, and cardiac arrest.